I'm Bart Silverman, a board-certified oral maxillofacial surgeon. I run and manage a full-time oral surgery practice in New City, New York. And I've been practicing oral surgery for about over 30 years. I tend to lecture nationally and internationally. I just really love sharing knowledge. What I love also is being able to integrate new technology in my practice. Prior to Zimbis, we had major concerns in our practice. The medications were left out on the table before they went back into the lockbox. We were worried about waste. We were worried about patients possibly taking the medications and going off with them too. But we don't have to worry about that anymore with Zimbis. Everything is regulated, it's locked up, and we have peace of mind at nighttime. So the way in which we used to order implants was we'd have a sheet that was made up with all the implant sizes, and hopefully by the end of the day, one of my surgical assistants would call our implant rep. Many times we would get the wrong sizes, we would get the wrong healing abutments just when the patient was arriving, and of course we overnighted it. What I love about Zimbis is automatically we're going to get a reorder that's taking place. An invoice gets generated right directly to my implant manufacturer, or the invoice goes right to my implant rep. No longer do I have to spend and take time and have a surgical assistant do the ordering. You know, we partner up with a DSO, and monthly what we have to do is inventory. And it used to drive me wild where I had to take one of my head surgical assistants, and at the end of the month they had to pull away from chairside and they had to go ahead and count everything within our practice. What I love now is that with Zimbis, at the end of the month, we just push a button and a report is generated. You know, with Amazon, you can pick up and you can order immediately, you can get it within the next day or two. I think Zimbis allows us to do that. No longer do I have to carry now a 6-month inventory. Once my inventory drops below a certain number, automatically I'm getting my inventory just generated back to me again within a day or two. I only have to carry a 2-week inventory. If I had to give advice to a young practitioner now who's going to start in a practice, I would say, you know, without hesitation, they should definitely get a Zimbis machine.